And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
Sweet dreams are made of these. Who am I to disagree? I travel the
Yeah, welcome to the show, and we are talking about getting a good night's sleep or lack thereof. We have joining us on BoomerLife the SnoreDentist, Dr. Charnel Muir, and your license plate on your car says Snore Doctor.
It does, yes.
So people on the North Shore must see you bombing around with the Snore Doctor plate on.
I do. Yeah, they see me all the time. Every once in a while, I'll get a knock on a window trying to figure out if I can help.
And you just pretend you're asleep.
Yeah, there you go. Just nod off. No.
So the first thing is, what is a SnoreDentist? I was telling somebody that an interview on the first show that we'd done together, and they're like, what's a SnoreDentist?
Yeah,
so you must get that all the time.
I do. I get asked all the time. And, we tried to figure out whether I should be called a sleep dentist or a snore dentist. But the sleep dentist, everyone thought I would just put people to sleep.
That's right, yeah.
So that was wrong. So they thought, well, what do you treat? And I said, well, I treat snoring and sleep apnea. So I became the snore dentist. But first degrees in dentistry. Went to UBC, born and raised in BC, natural just to go to UBC for university, and went there right out of high school in the 80s and graduated dental school there with what they call the Doctor of Medical Dentistry in 1987. And really had a passion for airways early on. I thought it was really neat that we could affect how kids' arches and teeth develop with braces, and so kind of got into it through that route early on, and then just continued to study and learn more about it.
Now, your focus of dentistry is very specific. So and there are very few of you doing this. So what is it called now, the sort of designation you have? So
what I have is what's called a diplomat in dental sleep medicine. So I only practice in the field of dental sleep medicine, and I treat patients for snoring, sleep apnea, those types of breathing conditions. So I don't do root canals and fillings and veneers, and I don't have a hygienist. No, I don't miss general dentistry, although it was great. I did practice general dentistry really early on in my practice, but did a lot of braces as well as some sleep. And as it kind of evolved into more of a career on its own, then it slowly took over, and now I only do dental sleep medicine. And there's a few of us in the province that have what we call a diplomat. Now, it's not a specialty per se. There's so few of us. It's not like you're a specialist in
ear, nose, and throat specialist or something, right? Yeah. So you have somebody refers to you typically, or do they find you on their own?
Both.
Yeah.
Yeah. So I'll get patients that'll be, they'll hear of me through other patients. They'll see some marketing or mention of me or hear me on the radio. They'll find my Facebook page, and you don't need a referral like a medical referral, right? That's right. Yeah. Or they can just walk in themselves. They can be self-referred. They can be referred by their physician, and some patients are referred by physicians, and some patients are referred by CPAP providers because there's quite a high intolerance for that, and we might talk about that later, maybe. Yeah. So any number of ways people can find me, but they can come to me directly, definitely. Now, with a snore dentist, that connection is probably missing for most people. So how do you tie those things together? How do you explain it to people? I think a lot of people might understand that there's maybe some over-the-counter appliances, or they can go to the drugstore and get something for their snoring. So I don't know that the leap of faith from having an appliance and treating snoring is too large, but they would never have come across someone who only does that in their practice. So that part is probably the differentiator there. But it's basically, if you think about it, dentists are pretty good at head and neck stuff. Like, we work in the head and neck area all the time. We learned the anatomy in school. We learned everything to do with the mouth and behind it. And although most of us will focus our practice on the chiclet white teeth parts that are in the mouth, we certainly are well trained with the anatomy of the upper airway. And so it is a good fit that way.
Do you ever work with a ear, nose, and throat specialist for this sort of stuff?
I do. I often will work in partnership with ear, nose, and throat physicians because they're a great adjunct for patients, especially if they have trouble breathing through their nose, because not breathing well through your nose itself can cause snoring.
So that's somebody with like a deviated septum or something like that.
So they'll have, they had to save their girlfriend in a bar fight when they were younger, or, played rugby, or any number of things where they would have taken a knock to the nose. They would have deviated the septum. One side of the nose doesn't breathe really well. Or people that have really bad allergies. They'll get plugged up turbinates, they're called, those little lumpy bony things in your nose, and they'll plug the nose so they won't breathe really well. We
always joke around the knuckle dragger mouth breathers, right? But there's a lot of people that have to for some reason breathe through their mouth. Yeah,
I certainly, if my patients present with problems with nasal breathing or allergies, we send them back to their physician to get to an ear, nose, and throat or an allergist, because breathing through your nose has huge benefits, not just not snoring, but when you breathe through your nose, there's a reason you do that.
Now, do people who snore breathe through, are you getting the snoring through the nose or the mouth? Because I'm not sure, I'm asleep, I don't know how I snore.
That's right. Now, most people they can snore either way. But most people will have snoring because the tissues in the back of their throat are vibrating. And it's usually the soft palate, the little hangy thing that, is in the back of your throat, and it'll come too close to usually the base of your tongue, and that'll kind of rattle around and make snoring. So you can make the snoring noise come out through nose or mouth, but a lot of snorers mouth breathe. Right. So they've if their nose is plugged up, they've learned to breathe through their mouth. So we actually will treat some patients and they'll still have a little bit of snoring left because of the nasal problem. And then they'll go and see the ENT and have some kind of procedure to clear the nose as well.
Now, we had a specialist on from UBC's sleep clinic, and he talked about that snoring is... There's a sort of like a grade. If you snore, you do have some sort of level of sleep apnea, and that's what he described it as. He said if you snore, you're on the scale somewhere, but you're just not at the point where you maybe need a CPAP machine,
right? So
or what you provide,
or the oral appliance. So it's a continuum. It definitely is. We learn when we're younger and we're in college that occasionally we might snore if we go to a party and have some alcohol, or if we've got a cold, we might know that we snore. So there could be situational snoring, but once someone becomes a habitual snorer, they snore most every night, especially as it progresses, and you'll snore in any sleep position. A lot of people will start worse on their back, and then they're not so bad on their side, and then they'll snore no matter what. Even if the pillow's over their head, they'll snore. So once you kind of reach habitual snoring, there's a really good predictor that you have some degree of sleep apnea. It just depends on how bad it is as to whether it needs treatment.
And we're going to get into that because you have a study that you brought with you to talk about, the effects of all of this. And then we're going to get into the different situations between spouses specifically because they're sharing a bed often.
That's
and
right.
And then maybe they don't. They end up in separate rooms and all of the implications around snoring. And I'm sure there's somebody listening right now who's got the radio turned up a little bit because their spouse snores and they want relief. And is it often, before we get into the study after the break, is it often the spouse that forces the person to go and get some kind of treatment?
They can often be the driving force. So I've actually had the non-snoring spouse phone and make the appointment. Or I've I've had them bother the snorer enough that they finally go in and make an appointment, or the snorer just feels so bad and they're embarrassed that, they do come in on their own. But yeah, it's often one of the leading reasons for wanting treatment is to not disrupt your bed partner anymore. Or, other things like we might talk about some vacation issues that happen.
Sharing a cabin or something. You're going away skiing and keeping everybody awake. Well, you mentioned there's one where you're recently into the market again. You're divorced. You're back out there dating, and you snore, but you don't want your new potential partner to know you snore.
Yeah, it's starting to get serious. You're thinking, oh no, what do I do? Stay awake all night? What if I snore, right?
We're so vain, aren't we?
I know. But I had one, there was one patient in the other day, and I said, why is it that you're here? And he just looked at me and he said, darling, because, he actually wore a cowboy hat, but he said, darling, I've been renting a second room in Cancun, Mexico for 5 years.
Wow, that
because,
adds up.
She said, yeah, I'll vacation with you, but I'm not sleeping in the same room.
Wow.
Yeah.
I remember hearing a story. It was one of the morning radio shows I was listening to at the time, said that a wife had lost hearing in one ear due to the loud snoring from the husband.
Yeah, could be. I haven't seen that study, but I'd be very interested in it. Yeah.
Now, give us a little teaser about this study that you brought with you today.
Oh, the spousal snories. Yeah.
Is that what it's called?
Yeah. So, it was quite an extensive study. It was done over quite a length of time. And it was released in 2015, and it's got some interesting statistics on what snoring is doing to a household.
Well, we are speaking with the SnoreDentist, Dr. Charnel Muir, in North Vancouver, and everybody knows it's the Oasis Car Wash, right?
Yeah, kitty corner from there. Yeah,
that's where you are. Sort of, I guess that's at the foot of
Bewick and Marine Drive.
That's right. Okay, so that's a landmark in the North Shore. But you also travel around too to other clinics, right?
I do. I see patients on Vancouver Island, and I know that your show has some listeners on Vancouver Island. So I'm 1 week a month. I'm over on Vancouver Island, and I see patients from Victoria all the way to Campbell River.
Okay.
And then I do spend some days as well in the West Broadway corridor and out in the valley occasionally as well. Yeah.
Okay, so we're going to get into this study. When we come back, we're speaking with the SnoreDentist. If you're listening now, you're like, what? The SnoreDentist? That's true. And we'll find out all about it next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.